Which position is used to examine the abdomen? The correct answer is option C, supine. Abdomen assessment requires relaxation. Supine position exposes all abdominal quadrants. First step in physical examination is, the correct answer is option B, inspection. Inspection is always the first technique. Which instrument measures blood pressure? The correct answer is option D, sphygmomanometer, used for BP measurement. Normal respiratory rate in adult. The correct answer is option C, 12 to 20 breaths per minute. Which sound is heard during lung auscultation? The correct answer is vesicular breath sounds. Vesicular breath sounds are normal lung sounds. Capillary refill time, normal value. The correct answer is option C, less than 2 seconds indicates peripheral perfusion. Clubbing indicates. The correct answer is option B, chronic hypoxia seen in chronic obstructive pulmonary disease, cyanotic heart disease. Pulse is commonly checked at. The correct answer is option B, radial. Radial is most convenient site. Hyperresonance on percussions indicates. The correct answer is option B, emphysema. Excess air causes hyperresonance. S1 heart sound is due to closure of. The correct answer is option B, mitral and tricuspid valve. Body temperature is controlled by. The correct answer is option D, hypothalamus. Hypothalamus is called thermoregulatory center. Jaundice is best seen in. The correct answer is option C, sclera. Bilirubin deposits under sclera. Pupillary reaction test uses. The correct answer is option C, light. Pupillary reflex test, cranial nerve 2 and cranial nerve 3. Cyanosis is due to. The correct answer is option C, reduced oxygen saturation. Bluish discolorization of skin is called cyanosis. Normal heart rate in adults. The correct answer is option C, 6 to 100 beats per minute. Murphy's sign is used to assess. The correct answer is option C, gallbladder suggests cholecystitis. Glasgow Coma scale checks. The correct answer is option D, level of consciousness, uses high verbal and motor response. Palpation technique identifies. The correct answer is option C, temperature. Dorsal hand surface assesses temperature. BMI is used to assess. The correct answer is option D, nutritional status indicates body's fat. Neutral is tested in. The correct answer is option C, ascites indicates free fluid in abdomen. Technique is used last in abdominal examination. The correct answer is option D, auscultation. Palpation, percussion stimulate bowel sound, so auscultation must done first. Is used last in abdominal examination. The correct answer is option D, palpation. The proper sequence of abdominal examination is inspection, auscultation, percussion, palpation. The normal pupil size in an adult is. The correct answer is option C, 2 to 4 mm. Normal resting pupil is 2 to 4 mm. Babinski reflex in adult is. The correct answer is option B, abnormal. Indicates upper motor neuron lesion. The best position to examine the rectum is. The correct answer is left lateral sims. Provide easy access to rectal area. Pulse deficit compass. The correct answer is option B, apical and radial. Indicates regular heartbeat. Tactile fremitus is decreased in. The correct answer is pleural effusion. Fluid reduces vibration transmission. Fine crackles in lungs indicate. The correct answer is option B, heart failure. Fluid in alveolus crackles. Battle sign indicate. The correct answer is option B, basilar skull fracture. Bruising behind ear is key sign. Cherry red leaves occurs in. The correct answer is option C, carbon monoxide poisoning. Carbon monoxide binds to Hb strongly. Trachea deviates from. The correct answer is option C, tension pneumothorax. Air pushes trachea to opposite side. Heberden's nodes appear in. The correct answer is option B, osteoarthritis. Bony swellings on distal interpharyngeal joints. Normal bowel sound frequency. The correct answer is option B, 5 to 30. Hyperactive in diarrhea, hypoactive in constipation. Thrill is assessed by. The correct answer is option C, ulnar and palmar base of hand. Vibratory sensation over artery. Pitting edema is assessed by. The correct answer is option B, thumb pressure. Depressed mark, indication of fluid retention. Wheeze indicates. The correct answer is option C, airway obstruction. Musical sound from narrowed bronchi. Most accurate core body temperature side. The correct answer is option D, rectal is a good standard body temperature side. Rhombus test is used for. The correct answer is option C, balance. Disorientation to time occurs first in the correct answer is option B delirium. Once pulse is seen in the correct answer is option B aortic regurgitation. Cervical lymph nodes are palpated using the correct answer is option B finger pads. Pads give better sensitivity. Barrel chest is common in the correct answer is option B COPD emphysema. Increased anterior posterior diameter. Absent bowel sound suggests the correct answer is option C paralytic ileus requires urgent evaluation. Using diaphragm of stethoscope detects the correct answer is high pitch sounds used for lungs, bowel, normal. Using bell detects the correct answer is option B low pitch for murmurs, broods. Root indicates the correct answer is turbulent blood flow, suggests stenosis. Evaluate the correct answer is option C L2 and L4. Deep turn-on reflex grading 2 plus means the correct answer is option B normal. 2 plus is expected response. Spoon-shaped nails occur in the correct answer is iron deficiency. Indicates anemia. Snellen charts checks the correct answer is option C vision acuity. Stenosis first appear in the correct answer is option C lips and fingers. Tinel sign detects the correct answer is option C carpal tunnel syndrome. Tingling indicates nerve irritation. Temperature is lower at the correct answer is option C early morning. Circadian rhythm low point. Bonding pulse occurs in the correct answer is option C fever or anxiety increased cardiac output. Skin turgor assess the correct answer is option C hydration. Poor turgor is an indication of dehydration. Crepitus felt in the correct answer is option C dense grating sound from bone friction. S3 heart sound suggests the correct answer is option B heart failure ventricular overload. S4 sound indicates the correct answer is option B stiff ventricle seen in hypertension. Guarding during abdominal exam it suggests the correct answer is option B peritoneal irritation. Muscles tighten due to pain. Orthostatic hypotension occurs when the correct answer is option B sudden standing drop in BP on standing. Universal precaution during examination includes the correct answer is option B hand hygiene. Hand washing is the most essential. Normal SpO2 level, the correct answer is 95 to 100% measures oxygen saturation. Of liver is done in the correct answer is option B right upper quadrant. Liver lights right upper abdomen. Rails means the correct answer is option C crackles heard in heart failure. Stridor indicates the correct answer is option B upper airway obstruction. Heart inspiratory sound. Acute pain signs. The correct answer is option B tachycardia. Pain stimulates sympathetic response. Pallor is best seen in the correct answer is option C conjunctiva indicates anemia. Kyphosis is curvature of the correct answer option C thoracic spine. Humpback seen in elderly. Heart apex beat is located is the correct answer is fifth intracostal segment mid clavicular line. Normal adult BP the correct answer is 120 by 80 mm of Hg. Meiosis means the correct answer is constriction of pupil. Ptosis occurs due to dysfunction of the correct answer is option B third cranial nerve. Oculomotor nerve palsy. Target test is done on the correct answer is option B forearm in adults. Use of pen light is for the correct answer is option C pupil reaction. Tympanic temperature reflects the correct answer is Gore body temperature. It is quick and reliable. Normal adult chest expansion the correct answer is option B 3 to 5 cm reduced in COPD. On palpation spleen is normally the correct answer is not palpable. If palpable it is an indicator of splenomegaly. Most common site for temperature in children the correct answer is option B axillary safe and easy site. Hollow organs produces the correct answer is option B tympani. Abnormal curvature like H-shaped spine is the correct answer is option C scoliosis. Lateral deviation. Eardrum is examined by the correct answer is option C otoscope. Visualizes tympanic membrane. Rubbing angle becomes the correct answer is option B more than 180 degrees. Loss of nail bed angle. Medical term for sweating the correct answer is option B diaphoresis seen in shock and anxiety. Dehydration sign the correct answer is dry mucous membranes. Hernia examined in which position? The correct answer is option C standing. Increases abdominal pressure. Make easy visibility. Intercostal traction indicates the correct answer is option B respiratory distress seen in infants or children. Skin temperature is assessed by the correct answer is option B dorsal hand surface. Normal heart sound include the correct answer is option C S1 and S2. Apical pulse heard at the correct answer is option D mitral area that is left fifth intercostal space. Crackles not cleared by the correct answer is option B coughing. Pain score uses the correct answer is 0 to 10 scale. Edema grading 4 plus means the correct answer is option C severe. Deep indentation more than 30 seconds. Deviation of uvula to one side suggests the correct answer is 10th cranial nerve lesion. Enlarged thyroid is called. The correct answer is option C, goiter seen in iodine deficiency. Whisper test checks. The correct answer is option D, hearing simple bedside auditory test. Cone shaped chest seen in pectus excavatum. PERRLA stands for. The correct answer is option C, pupils equal round reactive to light and accommodation. It is a standard eye assessment test. Petechiae seen in. The correct answer is option C, iron deficiency anemia. Spoon nails. Cranial nerves are. The correct answer is option B, 12 pairs. Pain radiating along nerve path is. The correct answer is option B, neuropathic pain.